Is it Mr. Roberts?
It is, yes.
Hello, Mr.
Hi.
Roberts.
Hello,
My
Doctor.
name's Dr. Oldsam, one of the doctors working on the ward.
Yes.
The nurse has mentioned that you wanted me to come and have a chat to you about things.
Yes. It's really, I've been in a while for some tests and things, and they've done the usual blood tests and scan, etc. And I'm just wondering if you made any progress with the results at all, because it's, really quite worrying, sort of waiting and, I've had this pain and everything and sort of, being sick and everything and, I'm getting really, a bit concerned as to quite what's going on because, in the stomach area it's not pleasant at all and, I'm just wondering what, what's going on in there.
Sure, so you've had quite a lot of things happen to you since you came into hospital, and I'm sure we can go through those and explain some of the results. But perhaps if you start for a start, if you tell me a bit about what led up to you coming into hospital and the problems you've been having.
Well, it was just a day or two ago, and I started with this, stomach pain, and fairly severe. It was certainly a pain. It wasn't ache or anything. It was a pain, coming through to the back sometimes. And I was being sick and everything and sort of feeling generally ill and miserable and everything. So, this is why I, came down to see, and I was admitted, and they say they've been doing these tests and everything.
Okay, so you'd had some stomach pain and felt unwell. And had you sort of felt unwell for a little while, or was it just over those last couple of days?
It's fairly recent actually, I think less than a week altogether.
Okay.
Probably started a little bit, about a week ago, and it sort of built up, and there's something happening in there that, shouldn't be.
Okay. And had you noticed anything else at all? Did you notice any other sort of symptoms or anything else funny that was happening?
Well, like I said, I was, sort of feeling sick and generally ill and everything, it's not been good at all.
Okay. And you've had some tests done.
Yes.
What do you know about the results of those, if
Nothing
any?
at the moment. I know these results take time to work out, so, this is why I've sort of been patient, but I mean, up to, it is quite a worrying situation. It's, what is happening.
Sure. And had you had any sort of thoughts at all about what might be happening or what might be going on?
Well, I mean, I did wonder that, you see these adverts on the buses and things about doing these tests for bowel cancer and things, and, with the sort of discomfort I've had, I wondered whether it was some sort of bowel cancer or something.
Okay, so...
Because, I certainly wouldn't want to have that at all, but, and whether you've been looking for that or not, I don't know.
Okay, but you thought that it might be quite a serious problem then by the sound?
Yes, which has sort of been very worrying. I know you've got to take time to sort the test results out, but it has been a worrying, short day or so.
Okay, well I can go through some of those results with you. There's obviously going to be quite a lot of information to take in. Is there anyone that you'd like to have here with you while I went through those results?
No, I live alone, I'm sort of on my own, so there's really, my parents aren't alive, and, there's only there isn't really anybody actually.
Okay, so you're happy for me to just go through those now?
Yes, put me out of my misery, please.
Okay.
Yes.
Okay, so I don't know whether you remember when you first came into hospital, one of the things that we did was some blood tests.
Yes.
And those showed that your liver function tests weren't quite normal. Okay.
So there's a problem with the liver then?
Yeah, so it looked as though there might be a blockage somewhere in the system.
Oh.
So.
Oh, I see. So it's the liver. So it's not bowel cancer.
No, it's not a bowel problem, but you've had the pain in the tummy.
Yeah, the pain's there. Yeah.
Yeah, and it's a sort of a problem somewhere else in the tummy. So, as I said, the first thing we noticed was that you were looking a little bit jaundiced or a little bit yellow. I don't know whether you'd noticed that yourself.
Oh, the eyes. Oh, yes, the eyes.
Yeah.
I don't know. I just thought maybe I was tired or something.
Yeah. And so, and then the thing we noticed with your blood test was that your liver function was a little bit abnormal. So that made us sort of start to wonder and to think, well, could this be a problem with the liver or one of the organs around there?
Right.
And so I don't know whether you remember then that you had a scan done.
Yes,
and you also
the tunnel
had
thing.
the camera test done as well.
Oh,
that
yes.
you had.
Yeah.
Okay. And so that scan showed that there might be a problem in something called the pancreas. Okay, I don't know whether you've ever...
No, can't say I have, no.
You've ever heard of that?
No.
But the pancreas is an organ in your tummy.
Right.
Okay. And one thing that it sort of is linked to the liver, and there's something called bile, and you might have heard of bile.
Yes,
So that drains from the liver, if you like, and it drains sort of past the pancreas and out into your bowels.
Right.
Okay. And so sometimes if there's a problem with the pancreas, or if there's a growth in the pancreas, then that bile can get blocked and your liver test can go all funny. Okay.
Oh, I see.
Okay, so that's what made us think, well, we'd seen you with the pain and not feeling very well and with these funny liver tests. And so we started to wonder whether you might have a problem in the liver or maybe in the pancreas.
So,
okay.
Do you know which it is yet?
Yeah, and so then, do you remember having the CT scan done?
Yes, yes,
okay.
I remember that.
And that actually showed that the pancreas looks abnormal.
Right, okay. Well, when you say abnormal, I mean, what does that mean? It's too big or what?
Yeah, so it looked as though there might be a growth on the pancreas.
A growth? Now by growth, do you mean, are we coming back to a form of cancer or growth?
I mean, that's something certainly that we were worried about when we did those tests, and that, and that's something we've been concerned about when we saw those CT scans. And
so is it a cancer then?
Well, that's where things are a little bit unclear, but I think it probably is, and I'll explain that in a bit more detail to you. So the CT scan showed that it looked as though there's a cancer or a mass in the pancreas, and that would certainly explain your symptoms.
Well, when you say a mass in the pancreas, is that the same as a growth, or?
Yeah, so a mass or a growth, I would use those two words, and perhaps if I stick to growth now, that might be a bit easier for you.
And you're saying this might be a cancer, this growth?
Yeah.
Yeah, okay. And in fact, you're saying it's likely to be a cancer?
Yeah.
So, if it is then, I mean, is this going to be treatable? I mean, it sounds a very difficult area to get to. I mean, can it be cut away or taken out?
So we'll come on to that, but just so I know that you sort of understand our logic and where things are up to. So we saw this growth, or this thing that we were worried might be a cancer on the CT scan, okay? And with the symptoms and the blood tests we found, that kind of backed that up a bit for us, really. Right. And so I don't know whether you remember then you went on to have the camera test, the test called the MRCP.
Yeah,
okay.
Camera.
And they were trying to do two things with that. One was to try and help drain this bile that I talked about, to get rid of the jaundice that you were having and to help some of the symptoms. Yeah. And the other was to try and take a small biopsy, so a small sample of this growth, this potential cancer, if you like, on the pancreas. Yeah. So that we could confirm the diagnosis or not. Right. Okay. So.
But you've not done that yet?
Yeah, no, you've had that test done.
I've done the test, but have you had the result? Because you said you thought it was a cancer.
Yeah.
So it is a cancer?
Well, I'll come on to that now. Right. It's quite a complicated sort of story, so I want to take it steadily so you sort of take everything in. So one thing they did when you had that test is they put that tube in, that stent tube, and that was to help drain the bile, so to try and get rid of the jaundice. And they did take a sample of this growth.
Yes, yes.
Now, unfortunately, and something that can sometimes happen, is that's not really given us enough tissue to be able to say for certain whether or not this is a cancer.
Oh, okay.
So we're suspicious, and we're suspicious because of your symptoms, because of what we've seen on the CT scan, and also because of, the blood results and everything else. Yeah. So we're suspicious that this is a cancer, but if you like, we've not been able to prove that, 100% or not.
So how are you going to prove it then?
Well, I think what we need to do is we really need to get our cancer specialists, so our oncology doctors, involved to really help us here. And I think we need to take their advice, decide, well, should we try and do a biopsy again? Okay. Yeah. So, the aim of getting a very clear diagnosis and being certain over this. But obviously we've got to weigh that against any potential risks of a biopsy. You've already had one camera test. Right. And I'm sure when you did that, they explained that there is a risk of things like bleeding.
Oh yes,
and
yes,
of
they
putting
did.
a hole in the bowel
Nothing
doing
happened.
it.
No, nothing happened.
Fortunately,
Okay.
nothing happened.
Yeah.
But, we need to be certain that, that we're doing a test for the right reasons whenever we do it, and that those risks, we can justify by needing to get the answers. So I think we need to speak to our oncology doctors to sort of ask them that question, if you like. Do we need to try and get some more tissue to make a clear diagnosis?
Yeah.
Or is there some other way that they'd want to get the information?
Yeah, but they'd need to confirm. I mean, if they didn't do a biopsy, then they wouldn't necessarily know if it was a cancer. What would be the way forward? I mean, would you treat it as if it was a cancer, or I don't know. I mean,
it's difficult for me to give you a clear answer on that, because it depends a bit upon the individual circumstances, and that's why we sort of need the involvement of the specialists. In some cases, if all the other information points towards it, and if, for example, we were thinking that you might need an operation to fix the problem, there might be an argument for saying, well, we need the operation regardless. Why don't we do the operation?
Yeah.
And then when we take away that growth, that tumour, we'll have our answer and we'll know exactly what we're dealing with then.
So the tumour's out. You need the tumour out in any case.
Yeah. So we don't do the second biopsy and we just take it out. Now, I don't know whether or not that would be the right, way forward. So I'm just explaining some of the things that I think the oncologist might say. They might suggest that actually, no, it will very much change what order we do treatment in. So we need to know for certain first.
I mean,
and if they were to say that, then we'd have to think more carefully about doing either the same sort of biopsy or a different type of biopsy to get clearer information.
See, if it's not cancer, is it? I mean, isn't it going to do damage leaving the tumour, the mass there? If it, even if it wasn't cancer, it shouldn't really be there, should it? So it needs to come out in any case.
No, and it's clearly causing you some problems.
Yes, But, so why not just do the operation?
Yeah. Well, obviously that's going to be down to sort of the oncologists and also the surgeons, if an operation they feel is the best treatment.
Yeah.
In some cases, for certain cancers, an operation isn't the first treatment and it's not necessarily the only or the best treatment. So it depends a bit upon what we're dealing with as to what order things will be done in. And so that might affect whether or not we were just to sort of say, no, let's go ahead and do it, or no, we actually need clearer information first.
Yeah.
And so I think that's why we need to really have the input from the specialist to help us out, really.
So basically, it looks as if, I mean, you're sort of talking about various treatments. It should be curable, this cancer, shouldn't it?
Again, that's not that I can't really give you a very clear answer on that. I mean, the scan showed that there is a mass there, so a growth at the pancreas, and it's not shown as any other abnormality.
And it's not spread, you said, so...
Not on the information we've got from the scan.
No.
But I think really we need sort of the specialist input to decide, about things and to give you a clearer idea of, is this definitely cancer? And I say things point towards that being the diagnosis, but we can't be 100% certain without that biopsy. And the best way to sort of treat things in your circumstances. Yeah. So I can't really give you clear information as to what that treatment's going to be, or how the future's going to look, really. But I'm hoping that after they've seen you, and with some more information, they should be able to advise you better.
Can we stop it there, just in the interest of time? Thank you. So the scenario was mainly about breaking bad news, or potentially but what could be bad news. What goes through your mind when you've got that type of information to impart onto the patient? What kinds of things are you thinking about and to make it as easy as possible, if you like, for the patient to take in?
Yeah, so I think for a start you're thinking about what their current understanding is, so where they're up to in their knowledge about what's happened, and what obviously this gentleman didn't sound as though he was worried about pancreatic cancer, but he had already thought that this might be a serious problem and a bowel cancer. So I think my first thought is always, what does the patient know already? And then you've got to start thinking about what they want to know, or what they're prepared, you know, what information they're prepared for. And then I asked him if he wanted anyone else with him, or you know, if he wanted the results now or he wanted to wait. So I think it's always important to find out what they want to know and what they know already.
Yes.
And then after you've got that information, you can start to sort of give the information in small chunks and just really keep assessing, you know, whether they're taking it in, where they're up to, and whether they want you to continue with that, or don't feel as though they could take it all on board at once.
Yeah. When you discussed the options for this gentleman, you said possibly re-biopsy, possibly directly to surgery, and possibly other treatments, maybe chemotherapy or whatever. Are there any other modalities that might help with the diagnosis itself and give a bit more clarity other than those things that you've mentioned?
Yeah, so for a start, the tumour markers might be helpful,
okay,
so might direct, you know, the likelihood of this actually being a malignancy and where that's coming from, if that's the case.
Yes.
And, you know, further imaging, so maybe an MR scan or something like that might give clearer information and help, you know, in the diagnosis. So that might be preferable first, I guess.
Yeah, excellent. Thank you.
Okay.
So this is obviously a breaking bad news scenario, and also not just bad news, but some there's a uncertainty. So it's certainly breaking bad news and uncertainty, handled very well and a very good pace, and leading up to the diagnosis, as in giving a warning shot and finding how much the patient knows beforehand is very important, because he was worried about cancer, and he mentioned cancer, and that was therefore brought up by the patient before being handled very well afterwards.